Hi, I'm Laura.
Hello,
All right, we're going to go ahead and start getting some information down from you here. What is your name
JP,
and date of birth?
10375
And where do you live?
in Derby.
Okay. Are you married, single?
I'm married.
And tell me a little bit about yourself. What do you do for work?
I'm a maintenance HVAC technician.
Is that all you
I do just about everything.
do? Okay. And then tell me what you're here for today.
I'm here for a routine physical.
Routine physical, all right. And says here too, maybe refill on your current prescriptions.
Yeah.
Okay. So gonna go ahead and start down a past medical history. I'm gonna kind of shoot a lot of questions for you. Just answer them the best you can remember. Childhood illnesses. Did you ever have chickenpox,
Mhm.
measles, mumps, pertussis, croup?
Mhm.
How about rheumatic fever, polio,
No,
scarlet fever?
I did have that when I was 4.
Okay. And then, do you, to the best of your knowledge, did you have all of your childhood vaccinations?
Yes.
Okay. Any accidents or injuries? Any
I
broken
broke
bone?
my wrist.
How old were you about when that happened?
About 13.
And which one? Which wrist?
My right wrist.
Okay. Any other injuries or accidents?
I had a motorcycle accident when
Okay.
I was about 16.
Okay. Any injuries from that?
I burned to my right leg.
Okay. Any other injuries?
Not that I can recall.
Okay. Any chronic illnesses? What do you take medications for?
COPD,
Okay.
chronic asthma. I take I cholesterol medicine.
Okay.
I take Spiriva for the asthma. I take Ventolin for the asthma, and I take Monjaro for my diabetes.
Okay. Any hospitalizations, surgery,
Gallbladder.
gallbladder? How old were you in that?
Oh, I don't. I was probably 20, 30 years old, maybe
Okay.
29, 30.
All right. How about your current immunizations? Have you had your influenza yet this year, or did you have it
Yes,
last year?
yes.
Last year. How about pneumonia vaccine?
Yes.
Okay. And then COVID boosters or your COVID vaccine. Are you
I'm up to
vaccinated
date.
today? Okay. Um, how about your routine examinations? As far as when was your last dental exam?
Last year,
Okay. Vision exam?
a few months ago,
Okay. And then any other specialty exams or anything? If you had your, by your age, I would think they maybe
prostate,
prostate exam. How about colonoscopy?
colonoscopy.
All right. Have you seen a cardiologist?
I have not.
Okay. Any known allergies? Are you allergic to any medications?
Go back to that one. I had a stress test.
Okay. All right.
I don't know if that counts.
Yeah. Perfect. Allergies. Any allergies to medications?
Not really.
Okay. Current medications. You mentioned a couple. Go over those for me again. You said the Monjaro. What's the dosage on that?
7.5 milligrams
Okay, and when do you take it?
once a week.
Okay. Um, what
Injection
what day?
Sunday.
Sundays. Okay. For your blood pressure medication, what medication do you take?
Lisinopril
Central. You take that daily?
daily,
Okay.
20 milligrams.
All right. And then Spiriva you do once a day. And then you mentioned Ventolin, so you have a
I have
rescue
a
inhaler.
rescue inhaler, yes.
How often are you using that?
Once every 3 days, maybe 4 days.
Okay. Family history on your mother's side. Um,
Diabetes,
diabetes. Okay.
um, cancer,
Okay. What cancer do you know?
uh, lymphoma,
Okay.
and I had a cousin that had leukemia.
Okay. All right. Any cardiac disease on your?
Yes, my grandma and my grandpa on my mom's side both had cardiac disease.
Okay. And then your father's side.
Ah, um, diabetic
Okay. Is that your dad?
is my dad.
Okay. Okay. Um, Gonna go over a review of systems, just touch base on a little bit of all of them. General health wise, how do you feel your health is?
Mm, not bad, but not great.
Okay. Um, any complaints right now?
No,
Everything's great. That's okay. That's all right. Fair. Any changes in your skin that you've noticed? Any lesions, rashes?
no,
Um, any changes in pigmentation?
no,
Any history of skin cancer or any issues
no.
that way? Do you wear sunblock?
Sometimes.
Okay. Alrighty. Any headaches?
No, I very rarely get headaches.
Okay. Any head injury, history of dizziness, vertigo, any passing out or anything like that?
Syncope.
Okay. How often?
I don't know. It's just when I'm sitting down and I stand up fast.
Okay. Fair enough. I see you wear glasses. Is that for near or far vision
I
or both?
I can see things far away. It's for reading basically.
Any eye pain, inflammation, any problems with your eyes, any history of glaucoma or cataract?
No,
Ears, do you have any hearing loss or any difficulty hearing?
no,
History of earaches, ear
no,
infections, anything as a child?
no,
Okay. Any ringing in your ears?
no.
Um, your line of business, have you been exposed to loud environmental noises or
Sometimes
any of your hobbies have loud noises?
motorcycles.
Okay. Um, num, as far as your nose, any discharge, sinus pain,
No.
problem with obstruction, allergies, like seasonal?
My wife says yes, but I don't think so.
Okay, fair enough. Um, dentures, or I'm sorry,
I do have dentures.
you have dentures, top and bottom?
Just chop.
Yes, top. Okay. Any pain or bleeding in your gums?
No,
Any sores or lesions?
no,
Any problems swallowing or hoarseness or sore throat?
no.
Do you still have your tonsils?
Yes,
Okay. And any problems with your neck, limitation of movements, lumps, swollen glands? Respiratory, you said you have COPD. Do you have any problems with chest pain or difficulty
no.
breathing? Experiencing any wheeziness or
Occasionally,
okay, shortness of breath on occasion?
occasionally.
Okay. Do you use your rescue inhaler? Does that alleviate those symptoms?
95% of the time, yes.
Any cough?
No,
Okay. Did you or are you a smoker?
I was
Okay. When did you quit?
2 years ago.
Okay. When did you start smoking?
Um, 90 in 1998,
98. How old were you in the 90? About 18?
17, 18.
Okay. And then as far as you said, you saw a cardiologist, and you're being treated for hypertension. Do you feel like that blood pressure is being controlled by the
Yes,
medication? Is it effective? Any chest pain, palpitation, any bluing of your skin that you noticed? Any
no,
fatigue that doesn't have any explanation?
no,
Any difficulty with breathing, with movement or um, with exertion?
no.
Um, let's see, any swelling in your legs?
Uh, yeah, once in a while.
Okay. Um, all right. Um, the swelling in your legs, does it cause pain or
No,
discomfort? All right. And then you mentioned that burn. Is there any injury there on your legs that are still a problem?
I have varicose veins
Okay.
now.
Okay. Any numbness, tingling?
No,
Do you feel like your extremities get cold or
no.
any
As I get older,
oh, okay. Any infections, ulcers, sores that won't heal? Okay.
no,
Gastrointestinal, as far as your ability to move your bowel, any food intolerances, heartburn, indigestion, pain in your abdomen? Do you experience nausea or vomiting on a regular
no.
basis?
All that's pretty much seldom.
Okay. Any history of ulcers or liver
No,
disease, appendicitis or colitis, or jaundice and
no.
healing in the skin? Okay. You said you had a gallbladder removed at age about 30. How's your bowel movements? How often?
Well, they were pretty often until I got on the Manjaro.
Okay. How often are they now?
Once a day.
Okay. Very good. Um, any history of hemorrhoids or any rectal bleeding?
Hemorrhoids.
Hemorrhoids. Okay. And you said you'd had colonoscopy.
Mhm.
Um, any you mentioned a prostate exam. Did you have any history with your prostate?
They, they gave me medicine, went down, and they said nothing else about it.
So at one point it was swollen
Mhm.
or inflamed. Okay. Any problems with urination, urgency,
No,
frequency,
no,
any problems, hesitant or having to strain,
no,
any pain in the groin, or
no.
flank, kidney flank pain. Um, what color is your urine
Light
normally?
yellow?
Light yellow. Oh, staying hydrated. Any noticeable problems with your genitalia, any discharge, sores, or lesions?
No,
As far as you, let's see, musculoskeletal, do you have any pain, um, like back pain, arm, leg pain,
always,
knees,
since I have to work, I got back pain.
back pain just with work? So it's with exertion. Um, any history of arthritis, gout, stiffness, swelling, deformity, any limitations in motion?
No,
Do you feel like you have any weakness in your arms or legs?
no,
Okay. Any problems with seizures, stroke, fainting? Um, have you noticed any tremors, paralysis,
no,
problems with coordination?
no,
Any problems, difficulty with speaking or swallowing?
no,
Okay. Um, any numbness or tingling?
no,
Have you noticed any problems with memory or nervousness or mood change?
no,
Have you had any thoughts of harming yourself?
no,
Any bleeding problems, bruising?
no.
Um, and then you did say type 2 diabetes, you're on the Mounjaro. Do you feel
Yeah,
like that's controlled?
controlled.
Okay. Um, I want to go over some kind of self-concept issues. Um, what kind of education do you have?
Some college.
Some college. And then you said your master mechanical HVAC. Was that um, a certification that you have?
Yes.
Any other certifications?
Master plumber.
Okay. Um, do you feel confident or comfortable in your financial situation?
Well, yeah, but I mean, I'd like to have more money.
But stable, no
Stable.
fears of losing your home or
No.
homelessness. Do you have any children?
3.
And then how about religious beliefs?
Seventh-day Adventist.
Okay. Activity and exercise. Sounds like you work a labor job, but do you also do any other physical activities?
I work out 3 times a week.
Okay. What kind of activities?
Weightlifting,
Okay.
running.
All right. Any other hobbies that might include activity like exercise or anything? No?
Nothing
Okay.
I can think of.
All right. How about your sleep? Do you feel like you get a good night's sleep?
Most of the time.
All right. How many hours per night?
7.
Okay. 7 hours. Fair enough. Do you snore?
Well, I don't know because I don't hear it.
Have you been told that you snore?
Yes, I've been told that.
Very good. Um, and do you drink?
No,
All right. Do you use any illicit drugs?
no,
You said you quit smoking. Um, and then nutrition. Uh, how's your nutrition? How do you feel it is?
that feels good.
Feel it's good. Tell me what kind of a typical day for you would be.
Smoked chicken, some broccoli, some corn, some potatoes. Um, that's for lunch, and usually that's for dinner. And then throughout the day, I'll have a protein shake and maybe a snack. You know,
What kind of snacks?
bad snacks.
Bad snacks. Okay. Um, such as like junk food,
Pop tarts.
Pop Tarts. Okay.
or cucumbers,
Okay.
you know.
Yeah, fair enough. How do you feel like you handle stress?
I feel like I handle it pretty good.
Okay. All right. And then, do you feel like you have any safety hazards or any things of concern in your
No.
life? Okay. And then, kind of circling back on that perception of health, do you feel like you've said that not bad but not great? Um, any other concerns as far as that? Anything you have specific concerns about?
Not really.
All right. Do you have any goals? Any healthcare goals?
Um, Live long and prosper.
Okay. All right. Okay. So we're going to move on to just get some vital signs for you real quick, and then we'll be able to wrap this up. Go ahead and start with a temperature. Okay. Very good. 97.8. Have you roll your sleeve up there a little bit and get this blood pressure cuff on you.
Measuring over. Please remain seated and refrain from talking during measurement, and keep cuff at the heart level.
Okay, I'm gonna borrow this hand over here also. You can just relax there.
Your blood pressure is systolic, 115 millimeter of mercury, diastolic, 74 millimeter of mercury. Your pulse was 70.
Okay.
Your blood pressure is normal.
Excellent blood pressure. Thank you very much. Last thing we're going to do is go ahead and get a height and weight. Back feet up all the way. All right, you can go ahead and step out. All right, I've got you right at 72 inches. I'm going to jump up on the scale there. Okay, excellent. Right at 200 pounds. All right, well, that's going to conclude our exam today. Do you have any other questions?
No, ma'am.
Okay, thank you very much for coming in today.
You're welcome.